Hey guys, this is Luis Moreno with Simply Health Insurance Agency. I just got done with a training session with all of my agents on how to crush it with selling ancillary products to our ACA clients. So I wanted to share what I do with them, with my agents, with you guys. If you ever decide that you want to partner up with somebody who's in the game, in the fight, with you guys and not just somebody who's teaching you all from theory or books or what they used to do, I'm your guy. So if you want to sell ACA, if you want to sell dental and vision, the ancillary products, get with me and I will be glad to help you out. All right. So again, do me a favor. I need for you to comment. I need for you to like this video and I need for you to subscribe to my channel. All right. So here's the topic: how to crush it with selling ancillary products to our ACA clients. Now, what I do is I do bundling, okay? So I'm gonna walk you through what I do with all of my clients. All right, so get ready, guys, here you go. All right, so let's get in here and we are going to run a quote. All right, so I ran a quote for a 35-year-old female making about 20K. All right, I teach my agents that whenever you look to the right and you see this CSR button, you're automatically going to go very robotic and you're going to go to silver plans. All right, and let's just say for whatever reason, no reason other than, hell, I'm just trying to make a point, I choose this plan that's an $1,800 maximum out-of-pocket plan. Okay, all right, so that's the plan that my insured selected and we're rocking. Now it's time for me to go to work. All right, so what I do there is when I get with my clients, I'm going to explain to them the plan. I'm going to go over the deductible, the co-insurance, the maximum out of pocket. I'm going to go over the co-pays. I'm going to check their doctors. I'm going to check their meds. I'm going to do my job and enroll them in the best possible plan. That's how my agents get trained. Then what we're going to do is I'm going to pull out the summary benefits and I'm going to explain to them how the plan works. Okay. And then I'm going to make two big points that are going to help me sell these ancillary products. The first point I'm going to make is this plan, your ACA plan, does not offer dental and vision. Okay. So I have a solution for you. So I'm going to jump right into that. That is the first ancillary that I sell. All right, so let's get in here, and I like to use Ameritas. Now, if you don't have them, shoot me an email, guys. My email's down below in the description. Shoot me an email, and I will send you contracting for Ameritas. I love them. They're great. They're national. Their PPO is awesome. Also, my dentist loves Ameritas. And I'm guessing he loves it because he gets paid good and quickly. So that was enough validation for me to push this product to my clients. Now, you can sell whatever dental vision. I mean, there's other carriers out there. I don't care, but I just like using something that is easy. Now, I like using this one because I get my own link. I get my own PURL. Okay, this link is unique to me. It's got my agent number embedded. I can enroll people using this link. I can also send this link and let people enroll automatically, and I get credit for it. I get commissions. I get paid. So guess what I do? It's out there on Facebook. It's out there on my emails as part of my signature. It's also added to all of my workflows that I create. Okay. So also, if I sell it in the state I'm not licensing, Ameritas will let me know. And what I will do there is I'll get licensed and then I'll get commissions on the product that was sold. Okay, beautiful thing. All right, let's get in here and run a quote. This is why I like them. I'll plug it in. Okay, I'll hit get started. Now, I'm going to get some options here. I'm going to get, do they want dental? Yes. Do they want vision? Yes. How many people? 1, 2, 3, 5, whatever. How many people in the family? Now, as far as billing or premium is concerned, they will always multiply times 3 max. So if it's 2 people on the plan, well, it's times 2. If it's 3 people or more, it'll be ×3. So whatever the premium is, you multiply it by that number. Okay, so we're 1, and then I get my quotes, guys. Now I have other videos, which I will link down below in the description on the specifics of this, but I'm going to get a good, better, best. Okay, pretty easy. All right, pick the plan that most appropriately fits your client. Okay, I don't want to spend a lot of time on this video discussing the actual plans because I have other ones, but let's go ahead and select this one. This is the best one, okay, in my opinion. Okay, but this one also works very good. Okay, the one in the middle, the boost plan, because it has child orthodontia. So if they got kids, this is great. Okay, if it's somebody with no kids, this one is a little better. There's no orthodontia, but it also has a higher, it's a richer plan, and it has a higher annual benefit. So I'm going to choose that plan. Then I go to the vision section. Same thing, guys. In the Ameritas training, which I'll link down below, you'll have an explanation of the vision. But here, a quickie on this one is it either covers them, gets them a pair of glasses or contacts every 2 years, and it utilizes the iMed network, or you pay a little bit more and you get a pair of glasses every year, and it uses the VSP. So let's just go with the best one. Now, this is why I like this. Check this out. Once I've done this, I'm going to go to the review and purchase. Okay. I'm going to confirm my choices here, and I'm going to hit enroll now. I'm going to choose an effective date. You can enroll today and start tomorrow. Okay. Pick your date, put your email, and then here's what you will do, guys. You will enter any dependents if they want to insure any dependents, a spouse or kids. You will give them credit for prior coverage. Okay, I'll discuss that in a minute on how that works and what it does for you. You review it, you enter your billing information, which is either a checking and account number for EFT purposes or credit card information. You agree, you send it. And then what Ameritas has done now, what they did in the past is send your client an email. Hey, create your account online, and then here's your cards. We never had access to them. Well, now, once I apply and I get my confirmation, I get ID cards, which I can then email to my insured. Beautiful thing. Okay. It is that easy, guys. All right. Now, I will also share this with you. Okay. I have this. There we go. Too many screens. All right. So Ameritas has a comparison brochure. So you've got your 3 different plans here, and this is a good little side-by-side comparison of the plans. Okay. It also tells you where the plans are available, and it does the same thing for vision. You have your choice, you have your select, but there is no basic vision, at least not in Texas. So it's either one or the other. Okay, so all good there. Okay, and then also you have kind of a flow chart here of where you're going to put people. If they're 65 and over, you will push them to the total plan. That's the most expensive one. If they're between 18 and 65, you'll go with the access or the value. I mean, you've got some options there. It's a pretty good little flow chart that you can utilize. Now, we'll share this with you. Let me get this pulled up here. All right, here we go. The credit for prior coverage. There's 2 other reasons why I like Ameritas. Number 1, I like them because they will give you credit for prior coverage. Okay. Now, share that screen so you can see it here. The credit for prior coverage. What it does for you, number 1, guys, is when you enroll in the dental plan, you have year 1 benefits, which are not as rich. And then you have after year 1, which the benefits get richer and the annual benefits increase. Well, if they have credit for prior coverage, they automatically go into after year 1. Okay. But here are some of the specifications on this. They must be replacing it. Okay, they had to have had that plan for 12 months. There cannot be a gap of more than 2 months, and it cannot be a DHMO or a discount plan. That's it. All right. Pretty easy on there. Plug in that information, and now they get credit for prior coverage. The next thing I want to share with you is you'll ask your clients to give you or to download the Ameritas app. So once they go on here and they download it, they can get their dental and vision. They can get all their information. So they can search for claims, and they can also do a provider search. Okay. Very, very good tool for them to have. All right. So let's get back to my quoting. All right. So all right, here's my quote. Okay, so remember, I am a total premium right now of $62.29. I haven't told my client yet. Okay, now do remember that they have an $1,800 out of pocket. So I will remind my client, hey, Mr. Client, do you recall your maximum out of pocket? This is your worst case scenario in 1 year. Your out-of-pocket max is going to be $1,800. Kind of tight, kind of tough. All right. Most people don't have that kind of money. And then if they do, they don't want to utilize it for this. So what I would highly recommend is I've got a supplement for you that will take care of it. I love using Allstate Health Solutions. Okay. If you don't have a contract with them, shoot me an email and I'll hook you up. But let's get in here and quote and enroll. Okay. So I'll put my effective date. I'll put my zip code, date of birth. Okay, choose the gender. I can add a spouse or a partner or kids and quote now. Now, what I do with Allstate has a whole suite of products, but I go straight to the accident. Okay, I'll choose accident. This person, I'll assume they're a non-smoker. And this is what I will do. Now, with this plan enhancer product, remember, you are going to choose a benefit amount. I like to choose one that best matches their maximum out of pocket. So the maximum out of pocket for the plan for this lady was $1,800. Well, I'm going to choose $2,500. My premium is $13. And what this does, guys, is it reimburses them for a covered accident. Okay, you can download the brochure. It's got your limitations on it. And your exclusions, it's guaranteed accepted, no health questions, no restrictions, no network restrictions. Very, very good. On this plan, you can add mom, dad, and kids. Not a bad deal. Of course, the premium will adjust for them. There's a $250 year one deductible, a $150 year two, and after year two, it goes to zero. The deductible disappears. But I just don't offer this. Okay, I like to go on here and add the sickness and the hospitalization. Okay, what this will do is it will add a lump sum payment upon the first 24 hours that they're hospitalized. Okay, it just writes them a check. Okay, it pays regardless of whether they have another plan. There's no deductible on this, and there's no network restrictions on this. Not bad. It does have a 12-month pre-existing clause, but that's in the brochure. Okay, I do that and I'm rocking. I'm at $28. All right, the next thing that I do, okay, and this has been huge for me. We are almost year to date 50 life applications, all because we started doing this. Okay, I'm gonna pull this up and share this with you. Okay. All right. So the other product that I'm starting to offer now is life insurance. So what we tell them is we discuss life. All right. And we'll tell them, look, we don't have a life policy. I've got a very small entry level $150,000 term with a 10-year period. What this means is that for 10 years, their rate is locked. What this also means is that I'm insuring them now when they're in better health than they will be in the future. I'm insuring them and locking that rate. And I'm also, this plan will give them the opportunity to convert it to a permanent plan within the 10 years. So this is a great way to get in and not charge them too much premium. All right, now let's go over numbers. Okay, so I haven't yet told my client the price. All right, so going over numbers, here's what I got. She's 35, so it's 1522. Okay, so here are my numbers. I am at 0 for the health plan. Okay. I am at $62 for the dental and vision. I cannot remember. Nope, wrong screen, sorry. My dental was 62 and change, and my Allstate was 28 and change. All right. And my dental and vision, I'm sorry, my life insurance was $15. I'm at $105. Now it is time for me to go to work. Check out this incredible pitch. All right, and you're gonna think, really, that's the best you got? But that's really all I got, guys. Not crazy. So, Miss Client, I've got a package put together for you that the majority of my clients take. Okay, it's a very good package, and I've put a lot of benefits into it. And here's what it is. Number one, we got your health care. Okay, you remember from our conversation that you have no dental and vision, and you have a maximum out of pocket of $1,800. I have added dental, I have added vision, I have added an indemnity plan that will reimburse you up to $2,500 for an accident or a sickness if you're hospitalized. And I'm including a 10-year term at $150,000. 4 products for you. 5, health or medical, dental, vision, the indemnity, and the life. 5 products for you, and my premium for all 5 is $105. This is what the majority of my clients purchase. Would you like to pay for this with a credit card, or would you like to pay for this package with a routing number and a checking account number? What would you prefer? That's it, guys. I wish I had something better. That's all I got. Okay. Then what we do is we kind of shut up and see what they say. If they come back, we're like, I really can't afford that. So, it may not be in their budget, guys. All right. Then you start shifting. All right. So tell me, no problem. Remember, we got 5 products. We can't get rid of your healthcare for sure. But tell me, of the other 4, what do you want to get rid of to get that premium down? Remember, this 62 is your dental and your vision. Well, I don't wear any glasses. I'm good. Take off the vision. Save them $16. Get it down. Now I'm at $90 or $89. What do you think? No. Okay, start playing with the numbers. See what you can do for them. But the best thing that you can do for you and your client is make the offer. You make the offer and you are rocking. All right, guys, that's all I got for you. I wish I had something better. Don't forget a couple of things. If you do not have contracts with your preferred carriers, with carriers for dental and vision, you don't have Ameritas or Allstate, hit me up. Okay, I'll get you set up with that. Next thing, on the life side, you may be thinking, well, who do I write life with? If you're an independent agent, Mutual of Omaha is good. Foresters is great. American Amicable, I think. I used to use Mutual. Now I do everything through Farmers because I'm a Farmers insurance agent. If it gets declined with Farmers, then I go out and I place it somewhere else. But pick your best carrier, go run rates. We made that little screenshot on Canva, the free version of Canva. Super easy to make, and then you can include it on all your stuff and send it out. So guys, that's it. Don't forget, comment, or first of all, information is down below. Okay, I got a lot of goodies for you. I'll have the Ameritas brochure. I'll have the links to the Ameritas video and the full-blown video that talks about all the benefits. I'll have the one for Allstate also on there. And I will have for you the links to the brochure so you can download those if you want to. I've got a whole bunch of other stuff in there. I'll give you the whole folder for Ameritas. And then also what I will do is I've got my, if you don't have a CRM, oh, I did forget one big thing. Oh, hope you're still here watching. Gosh, you know, every single one of us that does Medicare, we go crazy. We will sell our kids, get rid of the wife or husband for a turning 65 list. If you want your own unique turning 65 list, look at what I got here for you guys. All right. First of all, if you don't have a CRM, I have my link down for the CRM. Okay. You should be using one. It's one of those essential tools to being a productive agent. Make sure that you have a CRM. Now, what should you do? Or why this CRM? I have a ton of workflows for ACA, Medicare, Life, Dental, and Vision. And look at this one that I created. Every single one of my ACA clients goes into this workflow. Their name, their phone number, their email, what I enrolled them in. Then, and their date of birth. Then what this thing does is it searches for them. It's just working. When they turn 64 and a half, what they do for me is it sends me an email and a text, and it lets me know, Luis, you got one of your clients turning 64 and a half. I want to get to them before any other carrier or Medicare agent will. Then what I do is I start hitting them up with text messages and email, letting them know that I will help them. I'll help them with their Medicare journey. I'll help them with enrolling in Medicare Part A and Part B. I will warn them about all the other agents and not to do that. I'll tell them that I'm going to completely make their transition to Medicare easy. And guys, you know we get paid very well for new to Medicare. So just to give you an idea, this software costs $97 a month. It's the same price whether you go through me or if you go direct. You go direct to them, you will not get any of my workflows. Okay, go use my link. I'm going to fill it. I do make a little extra there, but you get a lot of content from me. Then this $97 a month, here's what it does for me, guys. Minimum, I sell about 10 Medicare Advantage plans a month. New to Medicare. That's about $6,000 in commissions. I get most, and I don't even buy leads. They are all coming from my massive ACA book and also my PNC book. Okay, that's where they're coming from. Okay, so I've been an agent for 25 years. If you're a new agent, you're like, well, I don't have that. Well, you got to figure it out. But if you've got a book of business, this will help you. You just got to put your clients into the CRM. Take advantage of the CRM. There's a lot of stuff in there that will help you cross-sell and maintain your book of business, help you with any E&O issue that you'll have in the future. It's a must-have. That is down below. I have my ACA 101 course down below. And then I also have my Facebook ad course, which I partnered up with Shauna. If you want to learn how to run Facebook ads, and that's where I'm getting the majority of my leads, click down below, get her course, and learn how to run ads on social media. All right, guys, don't forget, like, comment, and subscribe. Thanks again.